Okay, hello and welcome to another one of our awareness sessions at Nivarana. And before starting, I'll just like to introduce Nivarana in short. We are a public health platform, and we want to make like common but important public health topics easy for everyone to understand. So, with our awareness sessions, our goal is to address um, the common topics and the questions that most people have. And we want our platform to be a go to for them to get answers. And from people, from credible personalities who have experience in that particular field. So today we're going to be demystifying breastfeeding, and we have with us Dr. Neha Dwivedi, and young child feeding consultant, and she's going to be busting myths around breastfeeding and lactation, and talking about things which make breastfeeding a special experience for the mother and the baby as well. So, welcome, Dr. Neha, and thank you for joining us.
Hi, Divya. Thank you. And thank you for having me as well. Very excited to talk to you about all that breastfeeding is now, change the narrative about it.
Okay, so the first question that we have for you is what role does nutrition play in, like, the mother's nutrition? What role does it play in lactation?
Okay, very interestingly, it's one of the first things that mothers would talk about. I've just started breastfeeding my baby. What do you think I should eat? And even when I always say this, that we breastfeeding is one topic that, especially in our culture, we always have a lot of advice about. And especially with a mother who's just had a newborn baby, you will see people coming and asking her about her breastfeeding journey, and just very casually asking how it's going, and even giving advice. Like, I've seen even men like coming to her and with no professional experience about it, giving advice about how she should go about it and how things happened when they had their babies and stuff like that. Usually, and most of, in most of these conversations or interactions, it always, more often than not, comes down to nutrition, right? कि आप तुम ये खाओ, अच्छा दूध नहीं बन रहा तो ये खाओ और वो खाओ, ये बातें होती हैं कि अब तुम तो बहुत पतली हो, तुम बहुत कमजोर हो, कैसे बनेगा दूध? एंड सो देयर इज दिस काइंड ऑफ एन अंडरस्टैंडिंग और बिलीफ कि that nutrition has a big role to play, that what you eat will make you make milk. It seems almost as if they think that there's something extra that you can eat, that that there's extra milk that you can make, or the quality of milk can get improved or something like that. So on the onset, I would like to say that while nutrition definitely has a role to play in the way that it supports breastfeeding, right? So I would say, for example, the role of nutrition for a breastfeeding mother is the same as the role of nutrition for a normal human being as well. So anything that is that is nutritious and balanced, the easy answer is that anything that is nutritious and balanced is good for a breastfeeding mother. Of course, there would be some food items that may have a better effect on her production, but they do not act in isolation. All right. So, I mean, the fact of the matter is, even if there is a moderately malnourished woman, she can produce enough milk to feed for two babies, right? So, and that's a fact. So for to think that there is something extra that a woman can eat, or or there is something, there are some superfoods because of which she will go on to do very well. It's not the complete truth, is what I would like to say, right? Having said that, so far as she's doing everything correct for breastfeeding, that we can discuss as we go forward. Of course, there are certain things, like I said at the onset, I'd like to say she just needs to have like a nutritious balanced diet. But then there are things like things like green leafy vegetables, your dals, so lentils and chickpeas. There is methi, there are all your nuts and seeds. So all of these, and again, these are the things that we talk about for normal people as well. So whole grains, eggs, legumes, so all of these are a good so-called galactagogues, right? But like I said, their role only comes if everything else is also in place.
But to sort of ask you, like, if say there's a mother who comes to you asking, what should I eat? So can you break it down into simple language saying, subha ye khana
I'll
hai?
actually ask her, what is she already eating?
Okay.
Right? So
Yeah.
chances are she tells me that, because I also need to make her understand that her focus cannot all be on food only,
Hmm.
because normally a mother who has, there is no chance of her being malnourished, most likely she's eating all that she needs to. Right? There is nothing that nutrition will solve in breastfeeding, is what I'm trying to say.
Okay.
Right? Like so far as, so like the most important thing about breastfeeding would be the frequency with which you breastfeed your baby. So for example, the frequency with which you bring your baby to the breast. Now if your baby needs to be fed say 10 to 12 times a day, and you are bringing the baby 4 times a day in a 24-hour cycle, and you're eating all the galactagogues on earth, you cannot hope to effectively breastfeed your baby in those 4 times a day. I think the belief is कि वो 4 बारी में extra milk आ जाएगा और extra बच्चा पी लेगा. It's like saying कि हमें 3 बार खाना है, लेकिन हम अगर
Hmm.
एक बार में extra खा लें तो हमें next day खाने की जरूरत नहीं पड़ेगी.
No, but what
Yeah.
I'm trying to ask is, compared to a non-lactating mother,
Mm-hmm.
what diet change do you usually advise in a
I
lactating?
don't I don't advise any diet change. I,
Okay.
in fact, because I work as a childbirth educator as well, so I
Hmm.
speak to them nutritionally during their pregnant time also. So that time I give them some advice about, how they can, make sure that they're including fiber in their diet, how they're, making sure including other food items too. And I tell them to stick to that. I tell them to try, and in fact, I tell them that you do not necessarily need to eat for 2 people कि तुम्हें दूध बनाना है, not like a lot of people are given lots of those ghee ke cheezein. So I tell
Hmm.
them that you have a, like a moderate amount of ghee, like put ghee in your dal, and the way that you're eating, but you don't necessarily have to keep going and having a lot of ghee laden things only. But like there are certain things available in the market, like your lactation cookies, etc. Essentially what they do is, जो हम ये बातें करते हैं कि like oats are good and all of that, तो उन चीजों को या उन seeds और nuts को ही, they kind of grind them and prepare these kind of like easily eatable things. And so
Hmm.
they definitely, I mean, I would think that they definitely are fine. They'll help you as much as just eating. They're probably more convenient to eat. So if in a yes or no situation, I'll say yes, they help you.
But are there any market products we should like, or lactating women should watch out for, which are being marketed as कि ना इसको खाओगे तो milk बढ़ेगा, but it's actually not true.
Same thing, right? Like I said, जो भी natural products हैं that are being made of, अब जैसे lactation cookies भी होते हैं, they're made of,
Hmm.
you'll see the ingredients, they'll be made of these things only, these seeds and those oats, etc. They will work. They will work in the sense that they will, help you, have normal production. But like वही है कि like I said, expectation needs to be adjusted. You cannot think कि मैं बस ये खा लूंगी and that will solve my problem. So more often than not, if a mother comes to me in her postnatal period and she's giving me her, if she's presenting it as ki I am, I have a 40-day-old baby, I am taking all this, I'm like, okay, that's fine, you're taking all this is fine, what are you doing on ground is what I need to know more. It is not of much significance to me at that point until I know her history. So but
So,
yeah, just like I said, for a yes or no, yes, it'll work. I will say it's fine. There's nothing that she'll take that will harm it. ऐसा कुछ नहीं है.
so baseline is basically that nutrition is important, but it's not the
Yes.
only thing which is going to help you in improving breastfeeding
Yes,
or your
yes.
milk
I
output.
mean, so the whole point that if you're a thin mother, or you could be a thin but healthy mother. But I hear this a
Hmm.
lot with the mothers I work with, that if they're very thin, their family around keeps telling them तुम्हारा दूध कैसे बनेगा, तुम्हें और खाना पड़ेगा. And more often than not, this whole thing, ये खाओ वो खाओ ये करो, that puts stress on them.
Hmm.
That affects their production more. So that's why I'm saying that I don't. This whole focus on just eating needs to be calmed down a little bit.
So, you now that you spoke about the frequency, like you said, so how often or how long should a
Hmm.
mother breastfeed her baby?
Hmm. Okay, good question. So how often actually starts with everyone knows about this, and everybody's told about this when they just have babies, that your baby should be fed every 2 hours, right? While that is right, the baby should be fed every 2 hours, which essentially means you have to bring the baby to your breast every 2 hours, right? But we say that, try to stick to that cycle until the baby has gained their birth weight back, which happens around the 10th or the 14th day. Okay, once the baby gains their birth weight back, you can, switch to feeding the baby according to demand. So feed the baby on demand. But I think when we say that, it is assumed that now when you start feeding the baby on demand, it will be a lesser number of times a day. It seems as if कि 2 घंटे से ज्यादा हो जाएगा, baby शायद 3 घंटे में demand करेगा. But that's like, again, a flawed expectation to have. Usually you will see that a baby would want to feed before 2 hours also, especially newborn babies, something known as cluster feeding. And so we see these 3-4 week babies or 2-3 week babies wanting to feed more often, and that's fine. That's no sign of any abnormality. The answer is that you have to feed or cater to the baby's hunger cue. And hunger cue is not just crying. There are many hunger cues, like the rooting reflex or the baby smacking their lip too much. So so far as pick the baby up, put the baby to the breast when the baby is giving you hunger cue. That's one, for how often you should feed. And for how long you should feed, usually many times, mothers come to me and tell me that they've been told by whoever they went to last, that they should feed the baby for 20 minutes on each breast. That I would really like to very vehemently say that that's probably the wrongest piece of advice that you can give to a lactating mother, because it's like saying ki agar even when your baby becomes, say, 5 years old. I always give this example. Let's say you have like two babies in the room. You have a 5-year-old, you have a 7-year-old. Ab tum dono ko bitha ke and you have given them a plate of food and they are eating. Let's say one baby finishes in 10 minutes. Are you going to take the plate of the other baby away too? Of course, you will not. So when you will not do it to babies who are eating by themselves, how are you going to time a baby who just doesn't know? Like, so the answer to that is, firstly, you never time the baby's feed. You feed the baby until the baby does not leave the breast by his or her own self. That's feeding from one breast, and then you switch the breast, and then you offer the next breast to the baby. So either the baby takes that breast and again feeds for as long as they need, but if they don't, and if they take and they leave quickly, you don't have to force, you leave. And you try to keep like, you remember which side it is from. So I always advise, you can take a scrunchie like this and put it in your hand, so you remember the right breast was the one that was lesser used in the previous session. So you start from that side the next time. And that's the way to feed. That's the way to kind of time it. So no minutes, etc. No, timing of breastfeeding is wrong. It's baby led.
And something, I had heard from one of my colleagues saying that at night also you should feed them 3 to 4 times. So is it
100%.
again?
Night is extremely important. So I'm always talking about a 24-hour cycle. अब जिस अगर हम ये कहते हैं कि nutritional requirement of the baby is to be fed every 2 hours, तो उस बच्चे के लिए सुबह क्या और रात क्या is the same, right? So even in the night, when the baby is sleeping, and we obviously recommend that you sleep with the baby, and the baby gives you hunger cues, put the baby to the breast. So 2 hourly is not just in the morning or till sunrise, sunset. It's a 24-hour cycle.
Okay, so continuing the frequency and duration question, how do you determine if the baby is drinking enough milk?
Okay, yeah. So again, that's something I always tell mothers when I'm preparing them for breastfeeding, in the mothers I'm dealing with in the prenatal period, that no matter how much I prepare you for it, you will still definitely at some point come back to me and say that I think my breast milk is not enough. I'm sorry. I'm sorry. Can you hear me and see me now?
Yeah, all good, all good. Yeah.
Okay, sorry. I think it just yeah. So coming back to your question, when I prepare them, I always tell them that, you will come back to me and tell me that my breast milk is not enough. So my baby's crying too much, my breast milk is not enough. My baby's feeding too often, it's not enough, and it's not sleeping enough, so my breast milk is not enough, etc., etc. So uh, the only two legitimate ways of knowing if your baby is getting enough milk is if the baby is gaining weight every time you take the baby to the pediatrician. again, not till the 10th to 14th, okay, because then the baby will lose weight. And even as medicals, we forget that until we, have, someone tells us again. So I've seen a lot of mothers kind of start giving formula in the first 10 to 14 days only, because they're assuming that the baby is not gaining weight with them. So after the baby gains his birth weight back, whenever you're going to the pediatrician, the weight should increase. A, and B, there shouldn't be like a significant fall in the baby's diaper count. Okay, and again, now diaper counts ki bhi baat hoti hai. So now people think that, okay, that the diaper count also kind of changes from baby to baby, but safe to say that, so it could be possible that your baby has a different baseline than the other baby, but safe to say that 6 to 8 full wet diapers a day is something that we're looking at as an average, and should not it should not fall significantly from that. And exclusively breastfed babies may not even pass stools every day. So that's normal. So we're basically talking about wet diapers. But of course, we also include the diaper with the stool in case they have passed stools.
So to summarize, it's only two things: whether the baby is gaining
The
weight,
weight
but
and the diaper count.
watch
Yeah.
out that the first 2 weeks is when normally at least 10% of the weight is
Yeah.
lost.
They lose. Yeah.
So don't worry in the first 2 weeks. Don't rush to formula milk.
Yeah.
Continue breastfeeding and count the diapers. And there should be the same number, average, like around, there should be a range which you normally see.
So
But
until the fifth to the sixth day of birth, it corresponds to the day of birth, right? So like the first day, at least one diaper. Second till the second day, at least two diapers. So
okay.
until the 5 days, it should correspond to the day of birth, and then about 6 to 8.
Okay.
There could be more, and that's fine also.
So one of the issues that mothers often complain of are sore nipples after
Yeah.
breastfeeding.
Yeah.
And that somewhat prevents them from continuing breastfeeding or even trying to push them towards bottle feeding.
Yeah.
So is this normal? If not, how can women avoid this? Like lactating mothers avoid this?
Yeah. So I ask again mothers who I come across in the prenatal period to completely stop using soap on their nipple and areolar region, because no matter the claim of the soap कि हम बहुत moisturizing हैं, हम तो दूध से बने हैं और हम मलाई में ही रहते हैं, but it still dries the skin out. So when it dries the skin out, it kind of predisposes your skin to getting sore and or crack later. So one of the ways is to completely stop doing that. And you can also do some massaging of the, but I would say that do it only later, like say either after birth or after term. And so you can massage after baths, you can massage it with a bit of either extra virgin olive oil or coconut oil, but a little bit, just to kind of maintain the moisture. Some people say that उनके घर में घी से करते हैं moisturize. Well, that's also fine, but basically we want to keep the skin a little moisturized. But usually sore nipples would happen to mothers who where there is a latch issue. So I would say that make sure that if it persists, you just get it checked by a lactation consultant, and just see if the latch is fine and deep. It should be fine. Usually, if there is a latch issue and you have had a sore nipple, the minute you improve the latch, it doesn't hurt while feeding also. And then for healing, the easier thing to do is to take some hind milk. Hind milk is the milk that comes later during feeding. So you can do it like when the baby finishes feeding, you manually express a little bit, and then you get that the thicker milk that you get is hind milk, and just apply it on the affected nipple and let it air dry.
So what do you mean by latching? Just to break down that term.
So latching is, where the baby kind of attaches to the breast. So usually a baby is supposed to take most of the areola, and I can explain it to you through a model that I have. So usually the baby is supposed to take most of the areola in, right? While we think that the babies are only supposed to take the nipple in. So many times, if the latch is not correct, and which we explain to the mothers how to get it right, but if they don't know how to get it right, there are chances that the baby is only latching onto the nipple and chewing on the nipple, thereby, kind of hurting the nipple. But if the latch is nice and deep, which is most of the areola is inside the mouth, that the sore nipple situation usually doesn't arise. So we correct the latch and then we ask them to continue that. And for healing, we say, you can do the hind milk. And if it still persists, then there are a few more tips which I wouldn't want to just say, because then everyone will start trying everything. So then I would say the better thing is to like go to a counselor, see if your latch is correct, and then go on. Hind milk you can try anyway.
Okay, what about mothers who start their babies on formula milk before consulting with their pediatrician or their doctor? And they come in at, say, 1 month, 1.5 months, 3 months, and they say that my milk has completely stopped. That is why I had to formula feed the baby.
Hmm.
And they haven't tried feeding the baby in the past 1 month. And they say
Hmm.
that they don't have any milk anymore. How do they reinitiate breastfeeding then?
Relactation is we call that relactation. And what so relactation essentially is when you haven't fed the baby for some time, and while you had fed maybe earlier and then you've stopped. We see breastfeeding is quite simply a very basic supply demand relationship, between the breasts and the baby. Okay. So we see that if you make sure that you are creating the demand, breasts will supply. Or easier thing to say is that the brain will understand, right? And it will start producing releasing hormones, and you will lactate. However, the one thing that comes in the way of that is how the mother feels, right? So if a mother is stressed, is she's anxious, or she does not have essentially confidence in her ability to feed the child, is when she would kind of face production issues. Okay, no matter वो ला रही है नहीं ला रही है, क्योंकि ला भी रही है तो she may not be very, they act as inhibitors. So usually if someone comes to me at this time, say 15 days post birth or 30 days post birth, and they're like, we had to start formula, I actually sit down and I figure out how motivated the mother is. And then it's like a stepwise procedure. See, breastfeeding is a normal process, right? It's not a machine, it's not a medicine, so we cannot expect something to immediately work. But there is a method to it. I mean, so personally, if you ask me, I'll sit and I'll figure out how motivated she is. Step one will be to start encouraging her to spend more time with the baby, skin to skin, hold her more often, wear her probably, keep her to your bare skin, because that helps in the release of oxytocin, which is essential for breastfeeding. And then slowly start getting her to the breast. Sometimes there are a few techniques that we can try, that initially to encourage the baby to kind of feed at your breast. You can use a feeding tube, the other end of it, which you put on your breast. You can just tape it and put the baby there, and encourage the baby to suckle a little bit from, say, express milk or the formula milk that you had on the side. I also kind of ask them to start manually expressing, so that basically getting used to using your breasts or stimulating your breasts enough times a day. And slowly the production comes up. When they see that the production has started, when they start seeing some drops, then they also get encouraged. Then they also start putting the baby to the breast more often. And then usually it works out. Sometimes if there are unfortunately, again, like I said, there's a lot of advice going around. So especially if somebody's staying in a joint family, or somebody who's always surrounded by somebody who's telling her बार बार कि छोड़ ना क्यों कर रही है, formula ही दे दे, things like that. So that's something that we have to kind of fight against. So for me, it depends on mother to mother. I figure out what the mother's situation is, and I support her accordingly. So if it's a mother who I know is kind of surrounded by inhibitors, I'll probably message her every day. And I will say something. I will ask her what's happening, and I will try to keep making sure that I'm encouraging her to, or keeping an account of how many times she's getting the baby to the breast. So yeah, you can, relactation is possible. There are methods and techniques to it. But I would encourage, again, if somebody wants to do that, you go to a lactation counselor and they can walk you through it.
So now that you spoke about formula, let's discuss a little more about the entire debate around should formula be given to the baby, or some myths that people have, which say like formula fed babies sleep better, or it's
Mhm.
easier to formula feed than breastfeed. And there are women who have cesarean sections and they're unable to produce milk immediately after that, and the relatives, as soon as if she's not able to produce milk, then they rush to the chemist and get formula and start feeding the baby formula. So, uh, what is the entire theory around formula milk versus breast milk?
Yeah. So, actually, good that you mentioned the whole cesarean bit. Okay, a lot of the times I, meet a mother in the postnatal period, and I ask her, so what's the situation with the breastfeeding? And she says, I wasn't able to breastfeed my baby right after birth because I had a cesarean section. There is no because, unless you had the cesarean under general anesthesia and you were not alert and aware to cater to your baby. There is no reason right now for a mother who's had a C-section under spinal anesthesia to not be able to produce milk. Okay. um, of course, it's not supported a lot, unfortunately, because the mother's not given immediate skin to skin with the baby, and usually the baby is taken away, and there's a lot of separation that happens in the first few hours after birth. But we also have obstetricians who support this, and we see that mothers who've prepared themselves, they give the baby some skin to skin while the babies just come out, while they're doing the clamping and taking it out of the placenta, and the baby can be lying on the mother, and it takes support, it takes some kind of training of the staff also to kind of help the mother feed the baby on the breast. But it is possible, is what I'm trying to say. She can start feeding, or she can put the baby on the breast or give the baby colostrum right on the table. It is one of the advantages of having a C-section now in spinal anesthesia, which earlier we couldn't do with the babies. And also because the scar is down, so essentially there is space for the baby to be kept. That's one. The other thing is that of course the normal thing, or the WHO mandate, or the normal thing for a baby, or the good thing for a baby, for a baby to thrive, is to give the baby breast milk for 6 months, for the first 6 months to be given only breast milk, exclusive feeding, like we learn. So while that is, while that should be the normal, unfortunately, you won't, if you were to talk about people's breastfeeding journeys, you will see that that's not as normal any longer. Like when someone says that my baby is completely on my breast milk, people are surprised by that. And that has happened because of few things. But yes, formula being a big part in the market is a big reason for it, right? Like, I don't know if you guys remember, but you guys are fairly young, so you will remember. I don't know when we when these ads used to come. Ab nahi aate, right? Because ab allowed hi nahi hai. But when these ads used to come, about say 9 Pro, या कुछ भी, any of the formula, companies, they would always talk about those things as being better than what you can give to the baby. I understand. So if you could give your baby formula, you were supposed to be doing better for the baby, right? That was the thinking had shifted to that kind of mindset, which was wrong, which was flawed, and which by now we know that is not right at all. So formula is to be given only if you cannot somehow get breast milk for the baby, right? However, there are other things also. एक तो उन्होंने उसको better दिखा दिया. The other thing is that people, narratives have also been like you said, the baby sleeps better with formula. Now, we have to understand that breast milk is tailor made for the baby's intestines. Okay, so breast milk essentially is that healthy food that you eat, and it gets digested, and there is a good chance that you will be hungry faster, right? But that doesn't make it not enough for you. That is why the requirement is also to be fed more frequently. However, if you give the baby formula, it's that kind of heavy food that stays in your system and keeps rotating. So you think that you're fuller, and so yes, there is a chance that if you give the baby formula, the baby will seem to sleep fast, more, or quickly, things like that. But it's not something that is fine, or it's okay for you to do that just for making that baby sleep. क्योंकि अगर बच्चे को 2 घंटे में दूध पिलाना ही है, तो what's the whole point about sleeping or for a longer time? The other thing is that this I a lot of the mothers come to me and say that मेरे को बोला गया कि तुम पूरे दिन breast milk पिला दो, एक बार formula दे दो और वो बच्चा सो जाएगा. तो एक बार फॉर्मूला देने के का यूजुअल रेपरकशन ये होगा कि द टाइम नंबर ऑफ टाइम्स दैट यू विल गिव फॉर्मूला विल इंक्रीज, बिकॉज इफ यू आर स्टिमुलेटिंग योर ब्रेस्ट से 12 times a day 2 hourly, right? This is best case scenario, or 2.5, maybe 10 times a day. Usme bhi, if one time also you start formula, and so you start giving your breast like a gap of 4 hours, that's the brain is registering that as well. Okay, and so it, starts, affecting the release of hormones, and then so it can start kind of tapering down the production also, which we don't want. So that's not something that that we ever support, or I ever say that it's fine for you. Exclusive breastfeeding is exclusive breastfeeding. I still have a lot of mothers still think that they are exclusively breastfeeding, even though they give that one dose of one time of formula. That's not. I would definitely discourage them from doing that. I always say that successful breastfeeding lies in adjusting your expectations. Actually, so the whole narrative of कि बच्चे को routine में ले आओ, वो रात को सोएगा, सुबह उठेगा, इस time पे खेलेगा, इस time पे खाएगा. That's nature is not designed like that for a baby of that age. Time management तो हमें भी नहीं आती, तो हम बच्चों को क्यों सिखाने की कोशिश करते हैं? So adjusting expectations is a bit of a task, I think, for between newborns and new parents. So I would say formula. I wouldn't advise formula to people who have no problems with breastfeeding.
And what about preterm children, the kids who are born early?
They're actually not supposed. They unko to bola jata hai ki they are not able to digest formula only. I once had a mother who had delivered at 27 weeks, unfortunately, and she and the baby was obviously in NICU, and she was home, and she was really down and out, because she obviously things had not gone according to plan, and she'd had the baby very early, and every time that she would think of her baby, it would be the baby with tubes, right? So and then she was told that we have to have your milk, because that's all that we can give to the baby, so we cannot give the baby formula. So at that time I had to work with her to make her start expressing milk, but in her state that was a bit of a difficult task, because she was not up to anything. Forget having confidence in her ability to be able to feed the child. Every time that she would think of the child, instead of feeling love, she used to cry, that was out of remorse. And so it was very so actually for preterm we you have to give the baby. There's nothing like breast milk for babies at that time, also at that age, because like I said, their intestines are made for breast milk, not actually for formula. But
the bottom line is no formula feed. If you're not able to
bottom line is no
produce,
formula feeds. If you have breast milk, there is no reason for you to take formula. Yeah,
and
like I said,
even if
sorry.
yeah, even if you don't have breast milk, the best option is to consult an expert, a lactation counselor,
Yeah.
and that will definitely help. Chances of
And
that
that
helping
will
are more.
definitely help. And I would really like to say, like, I've been consulting mothers for lactation for about 5 years or little more now, just lactation also. And I'm 100% telling you that 8 to 9 out of the 10 mothers that would come to me do not have any medical issues usually, right? And also I think the answer lies in really helping a mother who needs to lactate. Also the responsibility is also on us as a community,
Hmm.
as doctors or birth professionals or lactation professionals. We have to make sure that we help. We always keep the best interest of the mother at heart, right? So like a lot of the times, if a mother will come to me and I realize that, okay, I can help her itna hi, but okay, the baby has a tongue tie that needs to get released, okay, that is coming in the way, and because of this baby is not able to feed. I will refer that to, for her to go to the doctor who can help her release the tongue tie. I will not say कि हाँ हाँ but आप कुछ करते रहो, ये करते रहो, वो करते रहो, या express करके पिला दो, because that's not in the best interest of her, unless the tongue tie is not hurting, so that way. But we see a lot of I once had a pediatrician. I was in this place called Bhatinda at that time, and there was a pediatrician there who just delivered, and she did not even know that lactation professionals exist. The only reason she came to me was because some, like a classmate of mine from Harding was her senior when she was doing peds, and she told her about me, and that's how she called me. And I was like, okay, so when someone comes to you with her baby, when babies come to you, कि आप what do you tell them? She said, we tell them कि आप breastfeed करो. So I was like, अगर breastfeed नहीं कर पा रहे तो then she says कि हम formula दे दो. That's not in the best interest of the baby, and it's imperative that we kind of keep ourselves you don't have to do everything, but at least refer to the right people. That's
So
the
there are some myths, like mothers on certain medications, like diseases can't breastfeed. So any sort of myths or actual true facts that you have come across?
It's not a myth. Everything that, of course, we eat goes inside the breast milk. So yes, the drugs that you take will also go inside the breast milk. However, the risks of giving some breast milk, see, it's not going to be in every feed, right? Even if traces go, it won't be in every feed. But the risk of, essentially, the right answer for all of these things is the risk of not giving the baby breast milk, as opposed to the risk of giving the baby some milk with traces of these drugs is much lesser, right? So we say that, at least this is the advice I give whenever they say that we have to take this medication for something. I say just simply take it after feeding the baby. It's just so that you can increase the time between the next feed and the, because if you just take it and then uske jaldi, so the minute you give the baby your feed, both breasts you've used, then you take the medication and then go on to feed the next time. So yeah, essentially, even for HIV mothers, right, where we know that they can give the virus to the baby, to them also, the advice is to feed the baby, again, because the risks of a baby dying from HIV is far lesser than dying from not having breast milk and the conditions that you can get because without having that breast milk. And these are proven statistics, right? So yeah, mostly in most cases you give breast milk.
Okay.
That's the answer.
So, in women who have been, like you spoke about the mother whose baby was preterm and she was having some trouble expressing her breast milk and things like that, what are some good positions that you suggest for breastfeeding? And do things like lactation pillows or any other available products in the market, have they been proven effective in that case?
Again, positions are, so I always begin in my session, the position, the latch, basically the hold. It's called the hold, right? The how you hold the baby. So the hold and the latch is the last thing I speak about, although it's the most technical, right? But we say that until, if a mother instinctively can hold a baby and get a latch and feed the baby and there's no problem, she doesn't really need to bother about what position, what latch, and all of that. However, if she has problems, then we help her with some holds, right? Or we give her some basic guidelines about holding the baby. But the only difference is for basically, if okay, the basic difference is for, say, C-section mothers, right? Because a C-section mother will have a scar here, right? So for her, maybe holding the baby right in the front may be a problem. So for C-section mothers, we advise something known as the football hold. In the football hold, the baby can be held, in the crook of your arm. So the baby can be held in the crook of the arm, below the elbow, and be fed from that side of the breast and changed. So, but again, we also recommend to feed in side lying. Now, there's a lot of this thing about side lying ki bachcha choke कर जाएगा लेटा हुआ और इसलिए लेटे लेटे फीड नहीं करना है and all of that. We often forget कि बच्चा लेटा ही हुआ है at all times. अगर आप आगे से भी पिला रहे हो, ऐसे भी पिला रहे हो, ऐसे भी पिला रहे हो, बच्चा तो लेटा ही हुआ है, आप उठ के पिला रहे होते हो. So when you are feeding in side lying, you're the one who's lying down. But we recommend feeding in side lying because babies need to sleep, the mothers also need to sleep in the night, and if they get comfortable with side lying, they can clock in more hours of like restful sleep with the baby. Otherwise, imagine having to wake up every time, sit down, and then put the baby. So especially for holds, I would say, it would depend from mother to mother. And it would be a little specific to, we'll see what problem is she having. So usually it depends on, if a baby is too small, we see, okay, maybe a cross cradle hold can help the baby more or the mother more. But I wouldn't say that there's an average answer to it. It would depend on a mother to mother. Again, barely ever is the hold an issue. But yeah, nursing pillows is something that I think definitely works, because whichever way we hold the baby in, whichever hold that we hold the baby in, we recommend you to, to make sure that the baby's body is in a straight line. We recommend that you hold the baby, say, on your forearm. Now, if you're holding the baby on your forearm for too long, your forearm will get tired. So we always ask you to put like a lot of cushions below so that your forearm is rested, so that the baby can feed for a long. So जो nursing pillows होते हैं, they basically designed in a way that they get at attach it, like you can put it around your stomach and then hold the baby. So yeah, I would say they work. But I would say, before buying, if you're buying it, in a store, you can just go sit and hold and see what's comfortable. So and then get something that's more comfortable for you. I would recommend a nursing pillow for definitely easier feeding probably.
No, a few very important points have come out of that because I personally wasn't aware of the side lying and breastfeeding, and it makes a lot of sense. Ki
Yeah,
side mein late ke, if your mother can also rest and the baby is anyway lying down all the time.
yeah,
That's something which is very important. And again, the take home message from this is coming out to be more of comfort rather than following some textbook technique.
yeah,
So, based on our previous discussion, as long as the latch is perfect, as
yeah.
long as the baby is satisfied with the feed, and there is as much as skin to skin contact, the technique as such is the whole technique of holding, it's secondary. That's
Yeah,
what.
and
That's what
yeah, I just also want to include one more thing. She'd asked me, about the myth of the formula being a more convenient way of feeding, right?
Hmm.
I think that comes from the fact that you think that formula is something that because तुम्हें बैठ के नहीं पिलाना पड़ेगा तो तुम formula लेके कर सकते हो, and somehow I think this is a belief that it's a more convenient way of feeding. And let me tell you, nothing can be farther away from the truth, because formula is not cow's milk. It's not like you can put it in the bottle and you can just take it somewhere and just feed the baby with it. Formula you have to make, right? And then you have to make right before feeding, and you have to make formula in the right proportions, right? So you cannot afford to put more powder, and you cannot afford to put more water either. It has to be in the right proportion. Now, say a baby who's feeding used to feeding every 2 hours. You're the mother. I'm the mother of a baby who's feeding every 2 hours, say for example. Okay, and I want to say do a quick bank run, or a quick run to the mall or something, right? What will happen? I will have to clock it in a way that I can go and come back in 2 hours, right? Because I have to feed my baby formula, right? Now,
Hmm.
because I want to make the formula myself. Or I can leave it to somebody, but leaving it to somebody, you're never sure if they will be as, conscious of, keeping the proportions correct. And also your baby gets used to feeding with you. Even if you're giving the baby formula, if the baby is used to, being in your lap and getting fed by you, they may not want to take it from someone else. Okay, but because you have to give the baby formula, you have to make sure that this happens. However, as opposed to if you're a breastfeeding mother, you just have to pick up your baby and go everywhere. Mall में बैठे बैठे भी अगर 2 घंटे हो गए, तो you can sit in the side and feed the baby. It's actually a much more easier way of feeding your baby the first 6 months. If so, we always say mothers usually will have some struggle in the first few weeks, and I always tell them that I'm not saying your baby will stop feeding or start giving you बहुत ज़्यादा time in between and all of that. I'm not saying, but I'm saying that the more you work right now, the better the next few weeks will look for you, because once you have your breastfeeding relationship in place, you will almost be passively doing it. कि जैसे ही बच्चे को भूख लगी ब्रेस्ट पे लगा लिया, and you're doing other things, you're sitting with your friends, and it doesn't matter. And we normalize breastfeeding also like that.
Hmm.
I mean, slowly I've seen change in the last 5 years also. Not all mothers feel like, oh, they have to, dhako whatever, and and then only do it, or sit in a corner and all. The people are getting slowly better with it, and I encourage it, because I feel like the more we normalize it, the
Hmm.
better it is for the baby, for us all, in fact. It's
Yeah.
actually these stigmas that kind of have made breastfeeding difficult in the last few decades, I would say. So,
Yeah, coming to the question of expressing breast milk, because that's something that came up when we are talking about preterm.
mm-hmm.
Should every mother invest in a breast milk pump? If yes, so what is the technique? How to store it? The details regarding
um,
that.
yeah. So, I usually ask, if a mother asks me, should she buy a pump? I actually don't advise anybody to buy a pump in the beginning. Okay, because in the beginning we also don't want mothers to pump in the first few weeks or so. Okay, because usually unless they need. So because क्या होता है कि if you are pumping and feeding, as somehow some people have been advised in the past. Every once in a while I meet a mother who's been told कि feed करने के बाद pump करो. ठीक है? When we do that, we are actually creating more demand than we need. Okay, so when we are creating more demand than we need, what can happen is that it can lead to an oversupply or a fast letdown. When a fast letdown happens, the baby is also not able to feed properly. the baby will choke at at the breast, and will sputter out, and then the mother will say ki acha mujhe problem ho rahi hai feed karne mein. So to avoid that, we initially say that let the flow settle in, right? Let the breastfeeding relationship settle in, and then let's go to pumping. So um either if there is a mother who needs to go to work or something, and she needs to, there is no other way, and she has to keep or build a stash, ठीक है? और जैसे कि like you rightfully said कि वो प्रीतम मदर की बेबी की मदर थी, while we encourage manual expression more than pumping, because see manual expression में क्या होता है कि you can keep changing the placement of your fingers. Okay, so when you change the placement of your hands, you can you can make sure that all the quadrants are getting drained out usually. But pump se aise, but still pumping is definitely more convenient, then. So if there is a mother who has to like express every 2 hours or 3 hours, or she has to use it 3 to 4 times a day, I would say, yeah, sure. I mean, get a pump, and make sure that and there could be mothers who um, and this is very, it's not very common, but there could be mothers who do not, they have tried and they are just not able to, sorry for that, they're just not able to feed the baby, or the baby is that she's all touched out and she does not really want to hold the baby, etc. So then we say, sure, go ahead, and because getting formula as opposed to express breast milk, so it's a thing now, it's a priority. So breastfeeding directly is priority one, or express breast milk, or manual expression, and then pump, like that, right? So it's an as a need basis, I would say, right? And if you are expressing and keeping, so let's say there are mothers who are saying that yaar main na raat ko baar baar nahi ut sakti, right? So and she's sick, say for example, she needs a rest, so we say okay, you express it and ask someone to feed it. तो अगर मान लो 12 बजे उन्होंने निकाला, so 4 to 6 hours on room temperature, we just say you can just leave it at the room temperature, ढक दो, and then someone can feed, or you can feed within those 4 to 6 hours. If you're going to be using that breast milk, you don't need to store it anywhere else. If you need it for longer period, you can keep it in the fridge for about 24 hours. Okay, and in the freezer you can keep it for about a month, but actually you can keep it for more now, because but generally हमारे country में electricity issues होते हैं. तो या तो आप लोगों को specifically बताओ, asking them about all this, or we just say think of it as a month in the freezer. And also when how to use it, for example, you from the freezer you can get it to the fridge, from the fridge you can get it to room temperature, you can't do the opposite. So if I've taken it out from the fridge, and then also you cannot heat it on a direct flame or a microwave, so you either let it come down to room temperature, or you heat it in a double boiler. Okay, and so and then use it. But if you've used that and thoda sa reh gaya, you cannot put it back, so you cannot go back to the system, right? So then you discard it. Okay,
So it's
so
just a one-time storage. It's you express it.
I mean, yeah, it's a one-time storage in the manner that you can keep, like जो आपने freezer में रखा, you can keep it up till a month. But मान लो 15 दिन बाद you need to use it, you can keep it for 1 day in the fridge and then get it out, right? Like, yeah, but you cannot use it, keep it back, use it, keep it back. That you can't do. Then
Okay.
you have to.
So from the date of expressing, based on your storage technique, it's either a few hours, days to a month max.
Yeah.
But from the date of expressing.
From the date of expressing.
Speaking of milk storage, how common are milk banks in India, and who are they for?
I mean, unfortunately, they're not very common. And this is something that even I figure out whenever I have a mother from a specific state or city. Then I try to start figuring out where to. I know that in Delhi, we have it in Harding only. We have a milk bank in Harding. But a few times that I've tried to approach them, I mean, or I've tried to give that advice to the mother, there is a fair bit of effort that took. For them to be able to take it out. It usually makes sense if the mother is, say, admitted for something, and she's not able to, get, and or the baby, there are babies that have been given formula and it's been realized that they are not able to take formula or keep formula in, and they're facing some difficulties with formula. Usually, I also advise mothers, if they have any friends or relatives in their family, to request them, if they, and that works very well actually. And in fact, it was a part of our culture in the beginning. We had nursing this thing, Didi, dais, or who used to just nurse the others babies, right? So that I would say you should actually try to do that first. See if there is anyone, because every once in a while I have a mother who's overproducing too, especially this mother, the one that I was telling you about, 27-week-old baby. From not being able to express 5 ml, she went on to 700 ml. She had so much milk at the one point of time. Then she started asking me what to do with it, and I said, okay, you know what, you can donate it. These days you have lots of they're all networked. All mothers are are on some WhatsApp groups. I would say the best is to go to another mother. Most likely that a mother would be connected to something. If not, go to a lactation professional. They can also figure out in their circle or area circuit. They will have somebody who's overproducing or who has a stash. Otherwise, you go to a bank. So like in Delhi, you have it in Harding. In Bombay, you have it in this hospital called Surya Hospital. They have these milk bank that you can take from. But like I said, I think that the whole procedure, it's not really very well done at this point, I would think. So, it's easier for you to figure out if there is anyone else. And that works very well. I've done it a few times for the mothers I've worked with. And we are able to usually find a mother who's willing to share her milk before the bank can give it. So, yeah.
But that's actually something very interesting that he brought up, that a mother whose child was born at 27 weeks ended up
Yeah.
producing more milk, because that is very normal. The
It
brain sort of
has to be done, right? Yeah.
it's so tailor made, sort of, that when the baby actually needs more milk, the mother's
Yeah.
body already knows that, and more milk
Absolutely.
is produced. So
Not just that, not even more milk and all. It even changes according to weather. Garmiyon mein, the milk with the fore milk will be more, the hind milk will be less. Things like that. The baby's sick. It's amazing how breast milk is actually the superfood in itself. It changes according to the
yeah.
needs of the baby. It's amazing. So I sound like such a fan.
So, the bottom line coming out of this entire discussion is that breast milk is the best for the child. Um,
Absolutely.
it adjusts itself according to the baby's needs. The mother should know the best technique how to express breast milk, or feed the child. And the role of a lactation counselor comes in very handy then.
Yeah.
Mothers alone can't do it. It's a role of the community as a whole.
Yes, role of
The
a community
family.
as well. Yeah.
The family has to be very supportive. And in case still it's not working out, there are people known as lactation counselors, people like you, who are there to help out.
Absolutely.
And so, just to sort of connect people with you, how can they reach out to you if they need any help,
I
or
mean, right.
somebody like you?
So for somebody like me, again, like I said, there are communities. Most of the people like me, most of lactation counselors or lactation consultants, like my number is already there with a lot. I get a lot of mothers who found my number on these breastfeeding support groups. Okay, usually you go to a breastfeeding support group there, and social media comes in really handy. You write breastfeeding support or something, you'll find stuff on any of the social media pages, or like I said, on WhatsApp groups. For me personally, I mean, I of course have an Instagram handle and social media handles, but I definitely will have something formal very soon. But we have but usually, I mean, like I said, you speak to a lot of pediatricians also usually work with, they have references. So if you ask them specifically for a lactation counselor, they are usually able to provide. It's just that we don't ask, right? And it's not that difficult any longer. Like if you were to ask, even if you put it on Facebook as your status, for example, you'll find people. But yeah, I mean, I think it's just something that a bit of networking. But yeah, it's not something that's very difficult at this point of time. Delhi mein to BPNI bhi hai, so you can try to reach BPNI, and BPNI has a website of their own.
Yeah.
But yeah, essentially social media works well at this point.
So, to conclude this whole thing, the, the the health of the country definitely depends on the health of the mother and the child, and breastfeeding plays an extremely crucial role. Then this is something which has been picking up over the past few years, and
Yeah.
I feel this session was extremely important, especially because Lancet just came out with a breastfeeding special edition, and they have released
Yeah.
a lot of evidence on this. So to break down that evidence for the general public was extremely important. We also have an article already covering breastfeeding on Nivarana. So I'll attach the link to that article as well, where again Neha has featured her thoughts.
No,
Thanks a
that's
lot,
great. You
Neha.
guys are doing great work, yeah, actually, I have to say.
No, it's ultimately because of people like you who are willing to come in and share their experience. So it actually, because we are just a bunch of people who are trying to just offer a platform, but
Yeah.
ultimately it's the people who, again, agree
Yeah,
to come on
even
for
people
free.
like me who are still taking their time to make things formal, it's good to have people like you.
Yeah. So I'll be sharing Neha's formal services as soon as they're launched.
Yeah,
And till then, you can contact her on Twitter. I'll be sharing her Twitter handle, her email ID, and her Instagram
yeah,
account.
email ID and yeah, on my
Yeah,
handles.
so feel free to reach out to her for any help if you are suffering with poor lactation or finding any difficulties. So thanks a lot, Neha, for this entire thing. I think we have crossed an hour almost.
Yeah,
Thank you
sorry,
so
I'm so
much.
sorry I talk a lot.
No, it was really useful. I hope people find it useful. Do leave any questions you have in the comment section, and we'll make sure those questions get answered. Or you can
Yes,
write to me or Divya or Radhika, one of us. Our email IDs will be in the description. And do connect with us for our next session as well. We'll be sharing this multiple kind of sessions coming up, one per month mostly. And if there's anything you want us to cover, please do write to us, and we'll definitely look for an expert to cover those issues as well. So thanks a lot, Neha. Thanks a lot.
thank you, Harsh,
I
for
hope you
having
have
me.
a wonderful weekend, and
Yeah,
I'll see you again soon. Thank
I
you.
hope the same for you.
Yeah. Thank
Take
you all.
care.
Bye.
Bye.